Anong oras ka alis mamaya?
Are we going to start now? Or?
It's going to start in around 20 seconds.
Delay. How about sila Ma'am Lucy? Andyan na ba? From WAPR? Andyan na ba sila Ma'am Lucy?
I'm here.
Wala po. Ay, andyan.
Okay, we're live.
Okay, good afternoon. Good afternoon, everyone.
Good afternoon.
Welcome, Dr. Lucy Lasso from WAPR, President of WAPR. You're the closing po, ano po?
Hello, people.
Hello. Hello, everyone.
Si Amy Alaricia. Hi. Long time no see.
Start na po ba tayo?
Yes, hi, Doc.
Yeah.
RG. Kalahating
Okay na, Sir Jaco?
Yep,
Okay na?
we're live. Kanina pa.
Okay. Hello, good afternoon. I'm Leticia Abuy from PAAI. I will be hosting for today's webinar. We will start the session by a prayer and the flag ceremony. We'll follow the flag ceremony. Thank you very much.
Let us put ourselves in the holy presence of God. Father in heaven, always merciful and giver of life, we humbly ask that you bless each one of us, from the speakers, program committees, guests, and participants. Guide us to make better decisions as we incorporate what we will learn throughout this activity. Thank you for the infinite blessings and countless opportunities. Lord, today as we start our activity, may we always be grateful to learn new things. Shed the light of your wisdom and bless each one, especially our speakers, as they will share their knowledge to us. Through your mercy and grace, may peace and utmost understanding shine and dwell unto us. Almighty God, accompany each one and help us concentrate for us to gain more knowledge as we listen attentively. This we ask in your name. Amen.
Yes, welcome again, everyone.
Hello.
We will have the flag ceremony now, Sir Jason. I invite everyone to stand up.
Ito sa disaster. Mahirap.
Hello. Di ka pa sisiyan sa dagat, sa simoy at sa langit mong bahay. May pinag-araw sa paglayang ginagawa. Agis lang ang watawag mo'y may nananaginip. Ang bituin at araw natin, ako'y di magdilim. Walang araw ng wala.
Hello.
Buhay langit sa piling mo. Ang ligaya ng pangay manangin. Ang mga
Yes. Hello again. Welcome to session 3 of the Joint Forum on Mental Health, brought to you with the partnership of WAPR, the World Association, and World Association for Psychosocial Rehabilitation, and Philippine Academy of Acupuncture, Inc. For now, we would like to welcome Dr. Sancho Chong for the welcome remark or the opening remark
Yes,
from
my
Philippine
patient.
Academy of
Yeah.
Acupuncture. He is the president of PAAI.
Hi, good
Welcome,
afternoon.
Dr.
Hello, good afternoon, everybody. And
Hello, good afternoon.
on on behalf of the Philippine Academy of Acupuncture and also World Association of Psychosocial Rehab, we welcome everybody to join our this third session of the webinar on topics on psychological management of problems associated with this COVID. Okay, as we know, as was mentioned to us by Mom Lucy in our first session, with this COVID, we don't just have a pandemic of COVID. It's also a pandemic of finance and also a pandemic of psychosocial problem. It is because of this that's why we are having this session. Today we are very happy. We have two experts. Okay, our very own members and also directors of the Philippine Academy of Acupuncture. We have a Dr. Mike Vergara and also Dr. Randy Dellosa. They will be talking about the topics related to the psychological treatment of stresses. And these treatments will be also a kind of self-help therapies. Okay, so I hope you will benefit from these lectures. Okay, so welcome again to everybody. Thank you.
For now, I would like to thank you, Dr. Sancho Chong. For now, I would like to request everyone to use the chat box for your attendance. May request to write their names and their organization with their cell number if possible. And kindly unmute your microphones for us not to absorb all the noise sa labas po. For now, we will start with Dr. Jose Miguel Vergara. Dr. Jose Miguel Vergara is a public health advocate. He is a disaster risk management specialist, an integrative medicine doctor.
For the last description is, don't forget that he is the pogi since birth, according to him. Let's welcome Dr. Jose Miguel Vergara.
Hello, good afternoon.
Anyway, but
Yeah.
Dr. Miguel.
Doc Mike, before we start,
Yes.
Mike, before we start, we like to acknowledge the presence of the president of the World Association of Psychosocial Rehab,
Yes.
si Ma'am Lucy Lasso. Okay, and
Yeah.
also another director of board member of the World Association of
Vergara.
Psychosocial Rehab, si Ma'am May Fernandez. Hello, we welcome you to join us. Thank you. Okay, Doc Mike, you can start now.
Yeah. Yeah. Okay. Magandang
Dr.
hapon,
Vergara.
everyone. Yeah. I hope you don't mind that I just put my picture there instead of a live
Dr. Vergara around.
Yeah, I'm here. Can you hear me? Hey, can you hear me ba?
Yeah, we can hear you, Doc.
Yeah. Mukhang Letty cannot hear. Letty, can you hear me? No. Okay.
Letty,
Vergara.
See,
Letty.
she's calling my name.
Letty, can you hear us?
No.
Letty,
Hello, Dr. Vergara.
Letty.
Or we will just start with Dr. Randy Dellosa.
No, no.
Dr.
Ah,
Randy
no, no.
Dellosa is both
No.
psychiatrist and psychologist by profession. He
Wait,
is
wait,
a certified medical
call her.
acupuncturist
Yeah,
and clinical
somehow.
massage
Hey.
therapist. He, as a medical Qigong.
Wait, para mapansin niya lang tayo, ha?
Yeah.
Letty, stop.
Time out, Letty.
Time out. Letty. 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 Stop. Stop.
Okay, she's muted.
Mute. Naka-mute ka. Letty, naririnig mo kami? Baka bumitaw yung Bluetooth mo. Somehow she's not hearing us.
Yeah.
Our apologies, but Letty, time out. Letty, time out. Dr. Vergara is ready already for his presentation.
Yeah.
Maybe we'll just turn over to Dr. Vergara for a while. Letty, time out.
Let me call her. Huh? Let's see, just in case. Letty? Oh, okay, she's not answering. Okay, anyway. Hi, guys. I'm going to start now.
Yeah, please share your, you can reshare your PowerPoint na lang.
Yeah. But before that, no, to put things into proper perspective.
Mikey.
Yeah, I heard someone call me.
Dr. Mikey.
Oh, Letty's still trying to call me.
Letty.
Sorry, guys. Sorry.
Letty, read your message.
Letty, we cannot hear you, Letty.
Yeah, and she can't hear us also.
Dr. Vergara.
This is getting funny. Okay, wait. Huh?
Mikey, perhaps you can already start.
Okay. But we'll expect her to.
I'll temporarily, I might have to mute Letty na lang if she can't.
Yes.
I'll try to communicate. All of you continue na lang. I'll try to bring Letty out na lang siguro.
She answered.
Yeah. Letty, can you hear me? Yeah, we cannot hear you. We cannot hear you and you keep on calling for me. And ikaw ang there might be something loose. Maybe your Bluetooth or something.
Yung Bluetooth niya, Doc.
Okay, check it out because I'm ready. I'm ready to give my talk already. Okay. Okay. Sige. Please check your stuff. Okay. Sorry, guys. Sorry.
Okay, take it away, Doc.
Okay.
Parang JQ, no?
Okay, so guys, to put everything in perspective, can you see that? Okay. There's a pandemic, we all know that, and it's been more than 6 months, 7 months na siguro, and in fact more, 8 months, and yet we still don't have a clear picture of what medicines work and what don't, or how to manage these patients. If you look on a per hospital basis, iba-iba ang recommendations. Then you go pa to the different countries, iba na naman, diba? So, for example, the use of hydrochloroquine, in some European countries, they use it. Here, no, we don't. In the US, not supposed to, but they're confused. Okay, the use of vitamin C, it's being used in Makati Med, PGH, but it's not a standard medication for all COVID cases here. So it's really it's really still, everything's still up in the air. As healers, there's only so much we can do for patients. Okay, there's only so much we can do for patients. If they're mild or with moderate symptoms, you treat them with supportive measures. But when it comes to more serious conditions where they need hospitalization. Most of us are that's not in our realm anymore, no, of healing. So there is one thing, no, there is one thing that we can do, or we can all do, but focus on the preventive side, diba? Focus on the preventive side, and this is to increase our immune system. If you understand energies, no, it's a balance, no, everything from dark, darkness and light, no, positive and negative, no, all of these things. Okay? Um, and the
Bakit?
the thing to control, not the spread, or even to prevent yourself from getting the infection, is to increase your immune system, increase your health, because as I have always lectured before, there are three factors that will determine whether you will get infected or not. No? One is the pathogen mismo. In this case, it's the COVID virus. No? Second is the quantity, no, of the COVID. So first you have the COVID itself. No? How strong is that COVID? We have, I think, already 8 kinds of mutations, no? And there's one very strong one. I think it's called the B416D or something that was discovered already in Quezon City. So it's the strength of the COVID. It's the amount or the number of these, the quantity of these viruses, no, or pathogens that enter your body. That's the second. And the third is how strong is the host or your immune system. So there are 2 factors. It's basically a virus versus tao. Diba? If the virus is stronger than the immune system of the person, he will get sick, okay, and will be symptomatic. If the immune system of the person is stronger than the virus quantity and quality, they may get it, but they will not be sick. They will not be symptomatic. Okay, and because of that, you don't end up in the hospital, and you won't be one of the statistics of death. No,
Qigong.
okay?
Parang
So,
naubos.
so focus. It is within our power to focus on our immune system, and there are many ways of increasing our immune system. One of which, of course, is the diet. Eat properly. No? Be of good cheer. Be positive. Sleep well. Take lots of fluids. But when it comes to exercise,
Merienda yung milk egg seedlings sa baget.
there's someone talking pa rin. Jack?
Bumili ako ng sweet milk.
Okay. Can you guys hear me?
Wala na pang luma?
Yes, Doc, we can hear you.
Okay. There's somebody talking in the background there. Okay. So when it comes to exercise, most of us stay at home already, especially people like me. I'm senior citizen. I'm not supposed to go out of the house anymore, although I do. No, but I see the rest of yung mga barkada ko, of course, and senior citizens. They can't go out. They don't exercise well. No. So and it's boring. No, you get cabin fever. This is the reason why I chose this Qigong exercise. It's called the 8 brocades of Qigong. No, it is a very brief, smooth, transitional exercise. No, that's why it's called brocade. I'll tell you about it later. No, that will increase your immune system. Okay, by making, by regulating your qi, regulating the blood, exercising your internal organs. No. Strengthening you in general. This is the most we can do, to keep far away from COVID. Again, I select easy exercises. Okay, I tried doing a version of this many months ago, but I keep on forgetting it. I keep on forgetting some of the steps. There are only 8 steps here. But this one that I will share with you now is quite easy. I will suggest that you make space in front of your computer now. So as we play it, and as I dictate, you'll be able to follow. No, I don't know if you can tape it. I think you can tape it in your computers so you can follow afterwards. Jackson.
Doc, it's actually we can give them a link na lang.
Okay.
Yeah. But at the same time, they can watch this broadcast again later in YouTube.
Yeah. Okay. Now, what is a brocade? No, a brocade is a garment. No, well, it's actually tela. No, normally made of fine silk. No, heavy. It's used for coats. No? It's supposedly for royalty, but the focus on brocade is because of the silk. It's the silkiness. So the exercise is quite smooth. No, it's a silkiness of this exercise. No? And there are 8 steps to this exercise, which is why it's called the 8 brocades, you know, of Qigong. Okay, shall we start? I'll play it, and once in a while I'll explain. I don't know if they will explain it themselves here, but I'm gonna share it now. Okay, get ready, guys. Huh? Make space in front. This is only about 10 minutes. In this exercise, the practitioner does each exercise 4 times. Okay, I do mine only 3 times. Maybe I'm more tamad, no, but it says do it either 4 to 12 times per exercise, and there are 8 exercises. It's quite easy. You might not get it perfectly in the first time, but you know, siguro on second, third time na it's easy to remember. Kaya ito na lang ang ginagawa ko. Feeling ko mas madali. Okay. Now, okay, let me remove my face here so you can focus. Okay, I'll play it now, huh, Jack?
Go ahead po, Doc.
Okay, guys, when you stand up, no, the main stance is you stand up, relaxed, arms on the side, and your feet separated, no, as wide as your shoulders are. So little lang. Okay, I'll play it now, huh?
This is the 8 pieces of brocade Qigong practice. 8段锦. Ready position.
Okay.
Open the left. Shoulder width apart. Slightly bend knees. Holding hands in front of the ring.
Everything is relaxed.
Position. Keep the spine naturally straight. Breathing naturally. Allow the mind to be peaceful and relaxed.
So it relaxes the mind as well.
Lower dantian.
Energy focus on the dantian.
2 hands hold up the heavens to regulate the internal organs. Interlace the fingers. Inhaling, lift up the palms. Looking up.
Holding up the heavens.
Look forward. Exhaling, release the hands.
Exhale.
Circling down. Interlace the fingers. Inhale, rise up.
Right.
Look up.
It's 2 hands holding up the heavens. This regulates the triple burner.
Exhale, release down. Slightly bend knees.
The energy of the triple burner is like oil. No, if your triple burner is nice and healthy, it's like oiling all the organs of the body.
Exhale, release down.
So this regulates the triple burner and balances the energy. The first burner includes the organs from the neck to the diaphragm, like the heart, the pericardium, and the lungs. The second burner includes organs from the diaphragm to the navel, like the liver, spleen, and stomach. And the third burner includes all organs from the navel to the pubis, like the intestines and reproductive organs.
Exhale, release.
So exercise 1 to regulate the triple burner.
Inhale, rise.
Push up to the heavens. Okay.
posing as an arch, shooting both left and right.
Okay, this is a second.
Cross wrist,
It's like drawing a bow and arrow.
shooting,
Left side,
step back,
arm stretch, go back,
cross wrist,
relax, and do it on the right side.
shooting, step back,
You'll see many of these Chinese exercises are very descriptive talaga.
step open, shooting, step back,
This exercise improves the lung and the liver. Huh? This is for the lung and the liver.
cross wrist, step open, shooting, step back,
It also works by strengthening and realigning the lower back muscles
cross wrist,
and spine.
step open, shooting,
And for those with arthritis, it helps hips, the legs, the knees, and the ankles.
cross wrist, step open, shooting, step back halfway, holding one arm aloft to regulate the functions of
This is the
spleen
third.
and stomach.
It's separating
Inhaling, lift
heaven
one
and earth.
hand, palm up,
See that? Separating heaven and
other
earth.
hands pushing down, exhaling, release, Zhanzhuan.
One hand pushing up, the other one pushing down.
Other side. Knees straight. Exhale, release.
You'll see the hands move up and down, starting from the center of the body.
Pushing away. Exhale, release down. Inhale, lift up. Pushing away.
This exercise eases the liver and the spleen,
Release down.
and it helps for better breathing.
Inhale, lift. Pushing away. Exhale, release down. Inhale, lift. Pushing away.
Push up, push down.
Looking backward to prevent sickness and strain.
The fourth
Back to Zhanzhuan, palms down. Inhaling,
is
lift.
looking backwards, or the owl, the wise owl gazes
Exhale,
backwards.
roll the arms up. Inhale, return. Lift, exhale, roll the arms up. Look back, other side. Inhale, return. Lift. Exhale, look back.
This exercise is best for the neck and the neck muscles, especially when you're stressed.
Lift. Exhale, look back. Inhale, return. Lift. Look back.
It works on healing internal injuries as well,
Return.
and nourishes the internal organs.
Lift. Sway the head and shake the tail to expel fire from the heart and relieve stress. Step open.
Number 5
Inhale, lift palms up.
expels fire.
Circle down. Lean left. Rotate to right. Sway the head. Shake the tail.
This is called the horse stance.
Lean right.
It's as if you're
Rotate left.
riding on top of a horse. So the stance is wider and lower.
Sway head. Shake tail. Lean left. Rotate right.
That's swaying the head and swinging the tail.
Sway head. Shake tail. Lean right. Rotate left. Sway head. Shake tail.
That expels fire from the heart.
Lean
Okay?
left.
So kung galit ka or
Rotate
ano,
right.
you're too hyper, this is the exercise that you should do.
Sway head.
All of these
Shake
exercises
hand.
you can take out individually, no? If you want to focus on a certain
In
area.
right.
This is for stress
Rotate
and to
left.
take out, as I said, fire from the heart.
Sway head. Shake. Down. Lift hands up. Step back halfway. Moving the hands down the back and legs and touching the feet to strengthen the kidneys and waist. Inhale, lift hands up. Exhale, press down. Cross. Massage down from armpits back to hip.
While doing this, you can massage your legs and your kidney and your feet.
Exhale, press down. Cross.
You don't have to go all the way to your feet because that's quite difficult to do, no? Especially at my age. But try not to hurt yourself.
Exhale, press down. Cross.
Massage your kidney
Massage down.
towards your legs, towards your foot. Try to feel the energy that's in your hands, okay? Because you have energy in your hands.
Exhale, press down. Cross. Massage down.
Massage.
Inhale, lift.
This exercise strengthens the kidney and the waist.
Exhale, press down.
You cannot overemphasize the importance of a strong waist, because that's where Ming Men,
Inhale, lift.
GV3, GV4, that's all where it is, by the line of the umbilicus.
Cross. Massage down. Inhale, lift. Thrusting the fist and making the eyes glare to enhance.
This one has some like martial arts background.
Step right.
It's like a horse stance again.
Thrusting, eyes
You
glaring.
punch with your left, open,
Grasp.
you actually grab the hand and
Inhale,
twist it
jaw
and
back.
pull. Okay? So it's actually a
Thrust.
martial arts move.
Glare.
When you punch, grab the
Jaw
wrist, twist, lock it, and then punch.
Thrust.
Now,
Glare. Grasp.
and you have to focus well with your eyes.
Jaw
no?
back.
It's called punching with
Thrust.
strong focused eyes.
Glare.
It improves the strength and chi
Grasp.
of your body.
Jaw back. Thrust. Glare. Grasp. Jaw back. Thrust. Glare. Grasp.
This also releases tension throughout the body.
Bouncing on the heels to cure diseases.
And the last one, the eighth, no?
Inhale.
As
rise the heel.
written, it says it cures
Exhale,
diseases.
halfway, bouncing down. Inhale, rise the heel.
So
Exhale, bouncing down.
inhale, tiptoe, inhale, exhale, and bounce on the heel.
Inhale, rise the heel.
If you do this regularly, it's said to prevent and cure illness. Prevents illness and cures
Inhale,
illness.
rise the heel. Exhale, bouncing down.
Try to feel the energy on the from the ground, no? And anchor yourself, anchor your body to that energy from the ground. It helps also with balance and stability.
Inhale, draw the hands from sides.
We are at closing already.
Overlapping the hands at about 2 inches below the neck.
Left over right for women, so the right hand
To regulate chi.
is in dantian,
Female with
and for
right
men,
hand inside
it's the left hand that's touching the tummy.
body and mind relax. Breathing slow.
So for men, if you put the left hand by the tummy, then it helps regulate chi. For women, right hand, it helps regulate blood.
Massage face.
Again, women, left over right. No? That's about 2 inches below the umbilicus. And for men, it's right over left. You can do this more than once a day. No? More than once a day. Especially if you're at home lang, diba? It only takes about 10 to 12 minutes to do this. If you can massage your gallbladder line, even better.
Wishing you health and happiness.
Okay, that's it, guys. Okay.
Thank you, Doctor.
Okay.
Thank you, Dr. Miguel Vergara. Okay.
So it's
hear
a
me?
10 to 12-minute exercise. You can do it almost anywhere, really. No, but pick a comfortable area, quiet, no, where you can meditate, because it helps as well, no, in calming the mind. No? It strengthens the body but calms the mind. So it's really best for those who are locked up at home. That's like me. Okay. Do we have any questions here? Did you try it? Were you guys trying it?
Yes, Doc.
Okay.
I did try it.
Yeah.
Actually, it's applicable. It's applicable to me.
Yeah. Why? Why do you say so?
I'm so stressed.
And you're stuck at home, no? See,
Are you finished, Doc?
Yes. Yeah. You try to get
okay.
Try to get the copy and practice it. No, it's quite easy. There are some harder versions of it, no, which I abandoned also, and I went into this easier form. Okay.
We will welcome questions after Dr. Randy Dellosa's talk. Can we have Dr. Randy Dellosa, our next speaker?
Yes, can you hear me now? Can you hear me?
Yes, Doc.
Okay. So can I start?
Yes, you can start now.
Okay. Yeah, so welcome everyone. First of all, I'd like to acknowledge some particular people, namely, of course, Dr. Lulu Ignacio. Of course, we know her as one of the pillars of Philippine psychiatry, and it's an honor that she can attend today's lecture. And of course, we also are grateful that Dr. Tancho Chong and Lucita Lazo are here. We thank them for their leadership of their respective organizations. And I'd like to give special mention to Dr. Sheikh Hoxton. Hi, Dr. Sheikh. She is one of the favorite people of psychology. Yes, many people find inspiration in her because she encourages everyone to be the best psychologist they can be.
Thank you for the
Okay, so I'd like to start now. Can we show the slides, please? Yes, this is my title, Mindfulness and Qigong as Self-Therapy for Difficult Emotions. Okay, next slide. I'd like to say a little bit about myself. Of course, some of you will know that I'm a psychiatrist, a clinical psychologist, and a life coach. Of course, my goal is not only to treat disorders, but to help people maximize their fullest potential. Okay. Besides being a psychiatrist, clinical psychologist, and life coach, next slide. I am also a mindfulness retreat facilitator. So one of my favorite things is to facilitate mindfulness and psycho-spiritual retreats. In fact, in the picture, you will see me in the Philippine Plum Village group of Zen Master Thich Nhat Hanh. And in this group, what we do is a lot of mindfulness activities like mindful walking, like what we're doing in the picture, mindful eating, mindful sitting, mindful breathing. So everything mindful will be done in Philippine Plum Village group. Okay, you might want to attend the virtual online meetings of Plum Village. Okay, next slide. Many people don't know that I actually am an ordained Taoist monk, priest. Okay, I belong to the second generation of the Dragon Gate lineage, which spans way back to the 13th century. Okay. However, as a Taoist monk, it's not the religious Taoism that I'm into, but the philosophical and mystical Taoism. So in the philosophical and mystical Taoism, what we do is a lot of Qigong and meditation. And that's why I am a Qigong and meditation instructor too. Next slide. And one of my goals is actually to integrate mindfulness and Qigong into psychotherapy. As much as possible, I would like to learn as much as I can psychotherapeutic interventions and methods, just so that I can help my clients better. Okay, next slide. So now that you know a little bit about me, the topic of my talk is learning how to manage your negative emotions using mindfulness and Qigong. Okay, next slide. So first, let's talk about mindfulness. Next slide. According to John Kabat-Zinn, he gives a modern definition of mindfulness, which is the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. Wow, that's a mouthful. Okay, so probably for us to understand better, let's look at the keywords. Next slide. So these are the keywords. Mindfulness is all about awareness, paying attention on purpose, the present moment, being non-judgmental, and experiencing moment by moment. Okay, next slide. Sometimes a good way to understand mindfulness is to understand its opposite. Okay, so awareness, the opposite of awareness is, next slide, being unaware or living in autopilot. Hindi ba? Hindi tayo nag-iisip, automatic na ginagawa natin o iniisip natin yung pumapasok na lang sa isip. Di ba? That's what we call living in autopilot. Instead of paying attention on purpose, we, next slide, have poor focus and we get easily distracted. Okay? And instead of living in the present moment, we are caught up in the past and or the future. Di ba? We're always worrying about the future. And non-judgment, its opposite is being biased and being defensive and having all sorts of preconceptions. And lastly, the opposite of experiencing moment by moment is wasting the moment, di ba? And thus, the moment flies by quickly. So, what we're really interested in mindfulness is to develop, to nurture what we call the Zen mind, also known as the beginner's mind. And the Zen mind or beginner's mind is actually the ability to experience and observe situations from a fresh perspective of openness, acceptance, and curiosity. So you can look at that little baby, isn't it? How such a simple electrical cord can catch its attention, diba? And don't we wish we were as innocent as that kid? So that is the Zen or beginner's mind. Next slide. Now, we have here a metaphor of mindfulness given by Henepola Gunaratana, and he's a venerable Vipassana teacher, okay? And he says that mindfulness is mirror thought. It reflects only what is happening and in exactly the way it is happening, no biases. So to make it a bit more visual, can we go to the next slide? Here, look at this picture. It's a picture of the mountains, of the clouds, of the sky. And the mirror thought is symbolized by the lake, which almost accurately captures the scenario. So here's a picture of a clear reflection brought about by mindfulness, diba? As opposed to, next slide, this picture. Look at this picture. Now you see that the waters have ripples, and it doesn't capture the accurate depiction of the little house on the field, isn't it? So if we just look at the lake, then we see a distorted reflection. And symbolically, this is brought about by unmindfulness or mindlessness. Okay? Next slide. Therefore, the question next to ask is, what causes distorted reflections? Bakit pa distorted yung pananaw natin? Next. What causes distorted reflections would be the emotional and cognitive filters that we have accumulated through the years. Okay, now look at the picture. This is a guy with multiple overlapping lenses, diba? Now, how can you expect that person to see things accurately? The glasses, of course, symbolize the emotional and cognitive filters accumulated through the years. Next slide. Therefore, we don't experience situations or people the way they really are because our perceptions are filtered through overlapping lenses that we've accumulated since birth. Next slide. So where do these filters come from? Saan ba galing? The filters can be taught to us. So they can be taught to us by our parents, by school, by religion, by our friends. So they're almost imposed on us, diba? Secondly, the filters are probably imitated from others. Dahil ginagawa ng marami, ginagaya na rin natin, diba? Dahil yun ang paniwala ng marami, yun na rin ang paniwala natin. So this is what we call groupthink or herd mentality, diba? And thirdly, the filters can come from our own personal experiences. In other words, we are self-taught to wear filters. And most of these experiences, of course, would be negative personal experiences. Next slide. These are the negative personal experiences that create our filters. Okay, look at this. Childhood hurts, relationship hurts, emotional trauma, abuse, identity confusion, mga life crises, unfinished business, disappointments, frustrations, failures, stressful situations, grief. You know, all of us have experienced all of these since birth. And every time we experience these, nadadagdagan yung lenses natin. And every time nadadagdagan, nag-overlap yung glasses, yung lenses, lalong nadidistort yung pananaw natin sa reality. Okay, next slide. Therefore, sa totoo lang, we are mindful, but not mindful. Look at the cartoon. Yung thought bubble niya sa mindful, F-U-L-L, is it's so full of thoughts, di ba? Or stuff. Whereas in mindful, in the on the right side, it's kind of a peaceful thought bubble. So this is the difference between mindfulness and mindfulness. Okay, next slide. So if we think about it, our mind is really full of emotional baggage accumulated through the years. Buti na lang kung isa lang ang bagahe natin na karga, di ba? I would suspect that many of us, if not all of us, carry a lot of emotional baggage, di ba? Not more than one, probably a lot. Next slide. So, ano ang effect ng cognitive emotional filters? Kung meron tayong mga cognitive emotional filters, then we develop preconceived notions, assumptions, biases, interpretations, unrealistic expectations, transferences, cognitive distortions, defense mechanisms, rigid opinions. Wow. With all of that, how can we really see reality as it is? Diba? Okay, now I'll give you an example of your cognitive emotional filters. Can we go to the next slide? Let's talk about race. What if I give you the word, the phrase, black people? What are your first notions about black people? Diba? Whatever you think about black people would be one of the lenses that you wear. How about religion? What if I say Islam, Muslim? What are your automatic thoughts? Diba? With thoughts like what you have now, you're already jaded about Islam. Politics. I'll say a controversial name. What if I say Duterte? What are your automatic thoughts? Diba? How about gender? What if I say, well, something simple now, transgender? Okay, what are your automatic thoughts about them? Profession. What if I say basurero? Diba? Or what if I say psychiatrist, acupuncturist? How about age? What if I say 70 years old? So anything that automatically comes up probably comes from one of your cognitive emotional filters. Diba? Next slide. Generally, we are unaware of our emotional baggage. And emotional baggage actually subconsciously influences our minds and controls our lives. I'll give an example of how it controls our lives. Think about your life partner. Okay? You think probably that it were good traits that got you attracted to your life partner. Isn't it? But really, perhaps not. Because most of our life partners are actually family figures, okay? Like somebody similar to our mother or father. So basically, we're looking for people who might be similar to our family members or opposite them. And this happens on an unconscious level based on our previous experiences. Diba? Think about this, even the profession of being a psychologist or psychiatrist, what led you to this profession? Wouldn't it be your negative personal experiences also that made you want to help other people or understand yourself? Diba? So it's really the subconscious, the emotional baggage, or our filters that influence our lives. And thirdly, emotional baggage makes us react on autopilot rather than responding with mindful, critical thinking. So in the field of religion or in politics, nako, lahat tayo nag-iisip on autopilot. Hindi na natin ginagamit ang critical thinking. Di ba? And really, the more opinionated you are, the more influenced you are by your emotional baggage. Okay, I would dare say that. Next slide. So no one is immune from emotional baggage, okay? Even Zen masters. So according to this person, Barbara O'Brien, Zen masters provide essential guidance in the process that is Zen. But ultimately, they are just people with flaws. That's why we hear about Zen masters involved in scandals. Diba? Because even if they've reached a certain state of enlightened consciousness, somehow the emotional baggage subconsciously hidden still has a grasp on them. Okay. Now, I'm not only talking about Zen masters, even psychologists and psychiatrists are not immune to emotional baggage. In fact, that's what brought us to our profession. Diba? And this obligates all people helpers to get healed from their emotional baggage. Okay, next slide. What is one clue to the presence of underlying emotional baggage? Paano mo alam na may emotional baggage ka? It is when you emotionally overreact or underreact to a problematic, stressful situation. Okay. Kunyari, something simple happened, and then you blew your top like this volcano. You know there's something there that kind of triggered you, di ba? Kasi hindi proportional yung pag-react. Or what if something naman grave, serious happened, and yet you are underreacting? Like you are denying what happened, or you are avoiding what happened. Like this rock, you're as cold as a rock. Diba? You know that there's something there that is making you avoid or escape from that emotional situation. Next slide. Of course, I'm a bit biased. Being a psychologist, this is one of my cognitive filters. I would say the best way to rid oneself of emotional baggage and filters is to undergo psychotherapy. But I would say, if you're going to go through psychotherapy, try many various psychotherapies. Okay? Because if you just do one psychotherapy, medyo narrow yung tulong na maibibigay niya sa'yo. So if you go through a number of various psychotherapies, then actually you can experience the strengths of each psychotherapy. Diba? And basically, that's what I tried to do. And I enjoyed it very much. I tried psychoanalysis on myself. I went to a psychoanalyst. I went to a cognitive behavioral therapist, and I've gone through many psychotherapies for myself. So this is important for everyone. Next slide. So now this is the purpose of our talk, no? It's how to teach you to use mindfulness for self-therapy for difficult emotions. Dito sa picture, look at this. Some negative emotions would be frustration, sadness, shame, fear, grief, depression, despair, envy, doubt, diba? Things that we experience. And this is the process for using mindfulness. Next slide. Just as an outline, the way to use mindfulness is, number one, when you feel an emotion, stop thinking. Number two, immerse yourself in the negative emotion. Immerse yourself in the negative emotion. Number three, start being curious and observe the emotion. And number four, don't forget to love yourself. Now, this is the outline. Let's go into it by detail, okay? Next slide. When you become aware of a negative emotion, like for example, nalungkot ka, the tendency is to ruminate, to obsess, to think about the negative memory, di ba? Pero when you think or remember or obsess about the negative memory or thought, you're actually pouring gasoline into the fire. Di ba? Siyempre, kung palagi mong iniisip yung negative memory, di lalo kang malulungkot, o lalo kang magagalit o mainis. Di ba? So, once we catch ourselves with a negative emotion, we become aware and stop thinking. Next slide. The next step is, since we're aware now of the negative emotion, then we immerse ourselves in the negative emotion. How do we immerse ourselves? Okay, find out what you feel and feel it deeply. Why should you feel the feeling? Of course, feelings are meant to be felt. Diba? If you don't feel the feelings, then you are denying the feelings or avoiding them. So as a respect for your feelings, you feel it. Secondly, try to sense what you sense in the body. Okay? Like yung lungkot na yan. Saan mo na-feel yan? Sa lalamunan ba? O sa dibdib? O sa tiyan? Kung sa dibdib, what is the physical sensation that you feel or you sense? Is it a heaviness in the chest? Is it a palpitation? Then sense the palpitation deeply and sense the heaviness deeply. Why? Because sensations are meant to be sensed, not avoided or denied. And as an added respect for the emotion, breathe. Breathe normally into the feeling or the sensation. Okay? What is the breath about? It's a symbol. It's a symbol of giving your emotion space to be there. Hindi ba? Air and space just to be there. Breathing is a sign of acceptance of the emotion. And thirdly, and lastly, continue feeling and sensing and immersing and breathing until you sense a kind of shift or change in the body. You'll notice that something will change a bit. And then when the change happens, like you feel a bit of lightness, probably, physically or emotionally, then you go now to the third step. This is the third step. Next slide. Start being mindful of it. Okay, be curious about the feeling or sensation, meaning watch it, observe it, and follow it. Kunyari, merong bigat sa dibdib, di ba? From the lungkot. Can you just distance yourself a little bit and watch what is happening now to the bigat? Is it getting stronger or lighter? Or is it starting to move? What is happening? Are there colors happening? Is it changing? So you are watching it, observing it. Diba? This is the mindfulness part. And as you're watching, you are breathing into your you're still breathing into the into the emotion. And then you continue this until you feel another shift. Probably you feel even lighter. Okay. And lastly, let's go to the next slide. You've done a good job. So you start loving yourself. What you do is you start wearing a smile. You feel the love for yourself. And you feel grateful that you can access your feelings and sensations. And you continue breathing into the feeling of gratitude and love. Okay? So can you see how respectful this process is of being mindful of your emotions? Okay? Next slide. I don't know if we have time, but let's do a little practice. Okay? For this seminar, I don't like you to feel sad naman. Okay? So what I'd like you to do is, I'd like you to remember or think about something nice, probably a nice memory. What is that? What is something nice that happened today? You got it? Sige. So just think about that memory for a while. And perhaps now you can tune in to how do you feel in your body with that happy memory. Where do you feel that happy memory? What is it like physically, that happy memory sensation? You like it? Well, if you like it, perhaps you can breathe into it. Yes. And if you like it, then you can breathe into it some more. And feel that good sensation some more. And give it more air and space. You might be surprised. If you breathe into it, it can even spread throughout your body. Isn't it? And so now you've done a good job. Why don't you just wear this smile on your face? and know that you love yourself for being able to feel happiness. And as you love yourself, I would think that you feel even more happy. So why don't you breathe in it some more? Okay. So this is an example of using mindfulness self-therapy. Now I used a positive emotion. You can also apply this on negative emotions. Okay? Sige. But we have to go on because there's still a second part. Next slide, please. If the thrust of Buddhism is mindfulness, which creates clarity of perception, Taoism uses Qigong, and its thrust is harmony and flow with nature. Okay, next slide. We have been honored by Dr. Mikey Vergara in teaching us the 8 brocades. Okay, and that's something that we can do. What he taught us is a physical form of Qigong. So what is Qigong? Can we go to the next slide? Qigong means cultivation of life energy. So Qi refers to life energy, and Gong refers to cultivation. And next slide. And Qigong is one of the 4 treatment modalities of traditional Chinese medicine, which includes acupuncture, herbalism, massage like Tuina, and Qigong. Okay, next slide. Now, Qigong makes use of TCM or traditional Chinese medicine. And one of the teachings in traditional Chinese medicine is that our organs are affected by intense or prolonged emotions. For example, if we get too overexcited or impatient, it may affect our heart energy. If we experience a grief or depression, because it's intense, then it may start affecting our lung energy. If we overworry and overthink, then it may affect our spleen or stomach. If we are always intensely angry or irritable, then it starts affecting liver energy. And if we are always afraid, fearful, or insecure, then it affects our kidney energy. Now, when we experience these emotions, it may not affect the physical organ itself, but it may cause blockages in the flow of energy associated with these organs. Okay? And ang paniwala sa PCM ay kung may blockage or kung mahina yung pagdaloy o sobra yung pagdaloy, then ito yung nagkukos ng karamdaman o sakit. Okay, next slide. So we don't have time, so we will just I'll just teach you a simple Qigong meditation technique, which is called the Qigong inner smile. Okay? Now just looking at the smile can already make you smile, di ba? Don't you wish we could always smile like that? Pero in the Qigong inner smile, a simple way to do this is, can we go to the next slide? Can we feel the smile? Okay, can we feel it? And then can we send it to through our body and to our internal organs? So apparently the first step is to remember something that makes you smile, and then to feel the feeling or sense the sensation of the smile, and then let it flow throughout the body, and then uh, feed the smile into the organs. Okay? So that's a simple Qigong inner smile technique or method. Next slide. Kasi sabi ni Mantak Chia, who is a Taoist Qigong master, sickness starts from negative emotions settling in the organs. The inner smile breaks this cycle, and it removes the cause and symptoms of disharmony by transforming destructive emotions into positive energy. Next slide. So let's do a 5-minute practice. Okay. First of all, can you just close your eyes and just put on a smile? And can you feel the smile and sense it? Now we will just direct this smile into one organ for lack of time. Let's direct it to the heart. Let's picture our heart. And let's feel the smile in the heart. And as we feel the smile in the heart, can we just breathe into it? Thank you, heart, for doing your job. Thank you that even if you're asleep, you're still working. Not 24/7, but 100 over 7. You work full time just for us. We thank you that you work even if we don't pay attention to you. We thank you that even if we feed you with garbage, you are faithful in trying to make us healthy by circulating blood, which contains good oxygen, which transports waste to its proper destination, and which circulates antibodies good enough for as protection against COVID-19. The smile we feel is gratitude for your good work. And now let's breathe into our heart. And feel the smile even more. And it's good, isn't it? Okay. Let's open our eyes now. And you can do this throughout the whole body. Okay, not only to the organs, but even to your limbs, to your brain, to your eyes, etc. Next slide. Here's a final reminder in dealing with difficult emotions. Next slide. The best way out of difficult emotions is always through it, through them. And one way through them is using mindfulness and Qigong. Okay, next slide. However, if things get too rough for you, then there's Dr. Lulu and Dr. Lucy and Ma'am Sheikh and Dr. Tan Chachong and all the acupuncturists to help you. Okay, so I hope you picked up a little bit from this. Thank you very much, and God bless all of us.
Yes, thank you very much, Dr. Randy Dellosa.
You're welcome.
We are now welcoming questions from our audience. You can type in your questions at the chat box. But before that, we would like to promote our coming convention this October 24, 25. Sir Jackson, can we play the video? Thank you very much. Everyone is welcome. Acupuncturists or non-acupuncturists are welcome for October 24 and 25 convention. You can contact me. I'm Leticia Abuy. I'm the only employee of PAAI. So hindi po kayo mawawala. My number is 0927-267-6227. And we invite you to visit our page, Philippine Academy of Acupuncture, Inc. We have a PAAI page at FB. You can visit the page to be informed about our activities. Do we have questions?
Lady.
Yes po.
There's a question.
Yes po.
There's a question.
Yes, for Dr. Randy, do you have mindfulness seminar? A detailed seminar for mindfulness?
Yes, you know what? It's a challenge to do mindfulness retreats or mindfulness workshops online. Okay, and I'm still not used to this. So probably we have to wait until matapos yung COVID-19 crisis or pandemic so that we can meet up again and have mindfulness retreats and psycho-spiritual retreats. Okay. So we have to wait until next year pag may vaccine na tayo. And then there's another question about monkhood raw.
Yes.
Okay, my discipleship ba? There is a program for you to learn more about learned the methods of Taoist meditation and Qigong. Okay? And it's quite fun. And katulad ng tinuro ni Dr. Mikey Vergara, whatever you learn will be used until old age. Okay? So perhaps after the COVID pandemic, then we can meet up for Taoist meditation groups.
Doc Randy, there's a question here from coming from our YouTube live. From Kylan Winter. How does one just stop thinking?
Okay. One is to focus on body sensations. So thinking is analogous to clouds floating in the air. Okay, and we don't want to be caught up by our thoughts. We don't want to be caught up there. We want to be grounded. So one way to ground is to try to focus on the breathing and to sense the physical sensations in the body. You know, we already have examples of this in ordinary language. Okay, this, like when we say, you know, you're a headache, or you're a pain in the. I was going to say pain in the ass, and I said it. You're a pain in the ass, you know, and your ass really hurts. So it is somatized emotional pain. So you can start feeling that pain in the neck or in the body. That's the way to ground yourself and to stop thinking.
Any more questions? Do we have any other questions, or Dr. Tan, do you have any announcements or from WAPR?
Doc Randy, and this is a question for Doc Randy and Doc Mikey. Can you enlighten us on the difference between Qigong and yoga?
Mikey, would you like to answer that?
I'm so sorry, but Dr. Mike Vergara has another business outside.
Okay, so I'll answer that. When we talk about yoga, we're talking about static postures. Okay, and that also includes static postures or asanas, and then there's also breathing into it, and there's also meditation. Okay, and a philosophy behind it. It's the same thing with Qigong. So they're very similar. Probably the difference would be that the Qigong uses more fluid movements. Okay, just like dance. And the dance has a purpose of strengthening health. Okay, now Qigong can be done physically, pero if you are really an adept, if you're really good at it, then you don't even need to move. You can just move energy throughout your body using your mind. So another thing is yoga will probably work with the chakra system and the hormones. Okay, whereas Qigong will work with the meridians and the internal organs. Yes, so that's all I can say for now. And
Thank
yoga
you,
will have
Dr.
its
Dr.
roots in India, Hinduism. Yes. Yes, doctor. Can Qigong help in weight loss like yoga? Of course it can. Of course it can. Because what Dr. Mikey taught you is actually a gentle form of Qigong. Okay? There are vigorous types of Qigong, even similar to martial arts. So for sure you will get a workout. And if we talk about obesity or weight and being overweight, what is being overweight or obesity except a blockage in the meridian system or in the organs? Diba? Qigong will unblock it and let the energy flow through the meridian system, thereby normalizing your weight, appetite and weight.
Doc, there's a follow-up question here. What about anxiety symptoms wherein focusing on the physical sensations can be distressing? What's the best way to go about it?
Yes. Now, if you have a panic attack, you can try to apply what I taught you. Okay. But if it is too much, then there are some ways to go about it. As you well know, anxiety or panic attack involves an adrenaline rush, diba? Or a dopamine imbalance. In that case, you want to use up the adrenaline, and perhaps if you just exercise, exert physical activity, then it already uses up the energy of the panic attack. Now, if that doesn't work for you, because it makes the adrenaline rush even more, then you can try the breathing exercises of Qigong or mindfulness. Because the breathing techniques will relax the anxiety. But if that still doesn't work, then it's best that you just go to Dr. Sheikh or Dr. Lulu or Dr. Lucy or Dr. Tan or the acupuncturists. Baka you need physical help which through medication or acupuncture.
Okay. And there's another question here from Melissa Hamin. What to do in case toxicity of certain people triggers self-harm?
Wow, that's quite a... Oh, I see Dr. Lulu. Dr. Lulu, would you like to answer that?
Okay. I'm not part of the panel, but thank you for saying that. When you do have this severe sadness, depression, helplessness, and you think of killing yourself, there's no way you should not get professional help. Don't delay it anymore. For us as psychiatrists, that's a psychiatric emergency. Okay. My other comment here is, I don't think you can really stop thinking. If you stop thinking, you're dead. Period. I think the practice of mindfulness, even meditation, would help you learn how to detach from the feelings. But that doesn't happen overnight or after a lecture on mindfulness. It's a practice that you may need to do really every day to learn to really be more aware. The word here is being aware of how you feel, handle it. But oftentimes in negative emotions, it's not very easy to do that. And if the negative emotions linger, I might like to suggest that you again seek professional help. I do meditation. I've been on meditation 30 years. And I would always look at meditation and mindfulness as a way of really learning how to silence the body, silence the mind in harmony with the breath. And that is a practice. To a certain extent, I don't know, Randy is going to say something about it. But I do not think meditation and mindfulness is therapy. They help relax the person. If the person practices this beautiful practice of being aware in the present moment, non-judgmental, and being more in touch with feelings and thoughts, then that's really aiming at developing psychosocial well-being, or therefore it's a form of self-care. But I do not agree that mindfulness is therapy. When you have thought of therapy, then that's already something not quite the ordinary or not quite the normal. So you deal with that by psychological means. That's now psychotherapy. But I think you might like to refer to this meditation, mindfulness, the practice of being relaxed with yourself, as a mode by which you should practice, because you're caring for yourself every day and promoting your psychosocial well-being.
Thank you. Thank you, Dr. Ignacio.
There's a question. Lately, there's a question. Where can we learn Qigong?
Pretty soon.
Dr. Randy, where can?
Yes, pretty soon. There will be a Philippine Association of Qigong. And this is something that you could probably wait for. And it will be Dr. Tan probably will announce its opening and its programs. So please await for the opening of the Philippine Qigong Association. Now, I also want to say something about what Dr. Ignacio said. We have to differentiate between mindfulness meditations and mindfulness interventions. Okay, because now they are categorizing mindfulness meditations apart from mindfulness interventions. So what I was teaching in this lecture are interventions which have adopted mindfulness into the practice of psychotherapy. So we have a number of psychotherapies that use mindfulness now, which include DBT, CBT, plus ACT. Okay, so these are mainstream psychotherapies which have incorporated mindfulness as one of their interventions. Now, about stopping the thought, I would agree with Dr. Lulu Ignacio that she's right. We cannot stop thought. So probably I should rephrase it into diverting our attention or awareness into our feelings and sensations. Okay? Because once we start feeling, then we are putting our thoughts, our thinking process, our rumination, okay, or obsessions in the background. So probably it's not about stopping the thinking, it's about diverting the rumination or obsessions or preoccupations into feeling and sensing.
I ask the question. Have there been any systematic studies that show the effectiveness of mindfulness in A, promoting well-being in the Philippine context, and B, as a form of intervention in therapy?
Quick answer. Unfortunately, we have very little research on that. Because prior to making my presentation, I already tried to look into the mindfulness paradigms in Filipino context, but unfortunately, I didn't find any. Okay, perhaps one of my weaknesses is that I just tried to look for the researches on the internet. Okay, but perhaps in the libraries of the psychiatrists, psychiatric institutions, and psychological institutions, there may be researches made. In fact, what word can capture mindfulness in Filipino or Tagalog? Okay, I was mulling over it. And the phrase I thought about was, ito yung pagranas, pagtanggap, at pagmasid. Di ba? Ng isang sitwasyon o mga tao na hindi tayo apektado sa nakaraang pag-iisip o karanasan natin. So it's just a Tagalized form of not being affected by our filters.
There seems to be no direct translation of the word mindfulness in.
I'll share with you one word that can be used in a positive sense.
Yeah.
Okay? The word is pagnanamnam.
Hindi pa rin eh.
Yes?
It doesn't catch that. Pagnanamnam is taste or experience. It's experience, pagnanamnam.
Yes. So it's a weak word for mindfulness. A narrow word.
Are you differentiating between meditation and mindfulness?
Doctor, the research I mentioned already categorized between mindfulness meditations, which included Zen or Vipassana, as opposed to mindfulness-based interventions or therapies, which include MBSR, MCBT, BBT, ACT. In fact, what I taught is a variant of MBSR.
What does the acronym mean?
Mindfulness-based stress reduction, MBSR.
It's really not quite therapy, di ba? It's really handling the feeling. Because the nearest to that would be cognitive behavioral therapy. Because you are made aware of the patterns of thinking. And that doesn't happen overnight either. So you have various techniques in the sense of cognitive behavioral treatment, di ba? Because mindfulness really is a Western concept. Meditation is what Buddhism is really relating to. So the impact of looking at thoughts in the mindfulness thing is aligned when it goes to therapy, to cognitive behavioral therapy, because that therapy is here and now, being aware of thoughts and feelings, no judgments, no looking into the past, no looking into the future. It's the here and now. And the techniques of CBT will probably allow for that practice of meditation, of mindfulness, to be complementary or in fact enriching. But CBT itself has its own techniques.
Yes.
Spread is the aspect of mindfulness in the therapeutic community.
I didn't get it. Ano?
Widespread is the use of mindfulness in therapy in the Philippines. Is it a common practice already?
Randy?
Opo. Yes. Starting from the 1990s, mindfulness, there has been a surge of research on mindfulness in psychotherapeutic practice. So there's an exponential growth of research since the 1990s. Okay. And now I want to make another differentiation between mindfulness meditation and mindfulness-based psychotherapy. Mindfulness meditation, really, Doctor is right. It's not therapeutic because it's about a state of consciousness.
Yes, of course.
Yes. Whereas the Western-based therapies using mindfulness already are have digressed because now they're using it for therapy as therapy for disorders or problems. So there's a difference between the meditations and the therapies.
Of course.
It's probably more the sustained practice. I mean, my reference point to this comment would be that we our theme is about self-care in mental health.
Yeah.
So it is probably more the sustained practice of mindfulness that will contribute to mental health. We're looking at, I mean, for example, as a method, this third session really is about the how, or how do we practice self-care in mental health. So we're looking at Qigong, at mindfulness as techniques of promoting mental health or mental well-being. But this has to be done over a sustained period. It's something that you don't acquire overnight. Like people may think that by doing one session overnight, something will change. I don't think that's the idea. No, it is continuous and sustained practice and application that will bring about the results that are desired relative to mental health and well-being.
Yes.
What mindfulness does is that it directs your attention to the more positive thoughts and feelings and digresses you or takes you away from those that cause anxiety and stress in you. And the technique, at least I think that's the implicit proposition, is that it takes you away from the negative and takes you to the more positive feelings. That's the interpretation I make of of this technique. And since we're talking about psychosocial well-being, I think that's what we'd like to underscore. Now, as a form of therapy is another story. That's why I asked earlier the question of how widespread is it as a form of therapy? Although you're saying now it's not really therapy, but cognitive therapy may well leverage it or build on it. So our interest is more in how do we promote among normal people, in quotation marks, well-being at a time like this using this technique. And this is why we've requested, presentations. The thing, in fact, of this session is the how of self care in mental health.
In fact, if you refer back to history, and Randy had put it to John Kabat-Zinn, the origin of mindfulness is really the clinic at University of Massachusetts for stress reduction. And this is where it is really settling in the corporate world, in various other situations where it helps in help reduce and stress or promote total health, knowing that a situation is very stressful. So they promote, and I think it's really good also that there are programs of mindfulness in corporations, for example, learning to step back, learn to be silent, learn to silence the body and the mind if you go into the quiet ones. Or it's part, the whole yoga, Qigong, Tai Chi leads you to that because it brings you back to your health, to yourself as a person in, in harmony with the breath. And that's why they are looked also into the spiritual realm of a person kasi it's concentrating on the breath. And when you're talking on the breath, then that's really more spiritual aspect. And that's why we have promoted it, because a major coping mechanism, especially in crisis and among us Filipinos, is spirituality. And when we do that, we go inside ourselves, we become aware of what is happening to us. We become aware that what is to be concentrated on is the present moment, because that's the only aspect in you that you are in control with. That's why what Randy had said, don't go into the past, don't settle with the future, because it's here now. And if you're really confronted with a deep stress or deep crisis and have, in a sense, no more control, if you go into either meditation or mindfulness, whatever, and being aware of yourself, of your body and your mind in the present moment, you'll probably reduce that stress that you feel. And this has been documented in studies on electroencephalogram. People who have been subjected to mindfulness or meditation, monks in Japan, for example, people in the US, for example, really been practicing mindfulness. They measure the electrical activity in the brain, and therefore they've showed that those who practice meditation, mindfulness, get into their relaxation state and sustain it if they sustain the practice. And that's relaxation is what is healing. I don't like to use it therapeutic. It's healing. It's being able to be aware, be in control, which is really the source of anxiety. So it's a practice. It started as a practice for stress reduction, and I think it's gaining popularity, especially in the corporate world, to have that. In schools, however, now I know that they have taught little children to have mindful times, from kindergarten up. There are many schools, kindergarten up, to just get the children or get the students to have time to be silent, to just count one with their breath if they need to. But they have learned that every day, as part of curriculum, they are made mindful, and that's being followed up. There are studies that showed that these children thrive, are academically achieving, are able to control their behaviors, they're less quarrelsome, they're less complaining, etc., etc. So it really is, you're right, Lucy, it really is promotion of mental health or psychosocial well-being. And many of these activities now, Department of Education would have this now as finding silence, being aware of the body and the mind, and being aware of the present moment, that the chaos outside there can be handled because you are in control of something inside you. And this is where I think you may have to consider that it's not just the body, the mind, and your relationships outside, but your spirit within that draws you into your inner peace. And that's, I think, where everybody wants to get into meditation, mindfulness, Qigong, Tai Chi, yoga. There's a sense of really being in control in that present moment. That's the commonality of all these Oriental practices.
Okay. Are there other questions? Letty? Letty?
Hi, hello, Doc. Yes, Doc.
Yeah,
Do
you're about to end now, no? Who will be?
Yes,
If
thank you
there are
very
no more questions, then maybe.
Do we have other questions from YouTube? Doc, Sir Jackson?
One last siguro. There's a comment here from a certain Emily Guerrero, but it is just a diversion. After the meditation, the person will still be troubled by her problem. Is this the objective? To break the thought process? What about learning to face the problem?
Right. Yes. So now we realize that mindfulness is not the only, it's not the cure all. Okay. Besides mindfulness, we have to practice. We need help other than that. Okay. So that's where coaching can come in. That's where journaling can come in. So it's our obligation also to learn many different types of help that we can get for ourselves. Otherwise, we would be limited to the strengths and weaknesses of that just one method or intervention. So let's learn as much as we can.
Yes, thank you very much. Dr. Randy?
You're welcome.
Okay, we will end the session now. Do we have any announcement from WAPR for their upcoming events, upcoming activities?
Well, perhaps I will mention that the world WAPR is coming up with some training programs, but that has to do with the NGO sector. For now, we're still developing the materials, but we expect that by sometime October, the training will be launched. We will give you further details later on the dates of this training program and who can join. Okay. The second thing I'd probably share is that we're also launching a research project on understanding the social determinants of mental health. We expect that by around October, November, we will be having an online survey, and subject to the GCQ restrictions, we expect that we would have some interviews. Maybe some of you may be requested to participate. And if we can organize focus group discussions, maybe some of the participants here could be invited to join the focus group discussion. So one is a training program, the other is a research project. And then, of course, you know that Dr. Tancho Chong is also in the WAPR board. We are currently under his committee. We are also undertaking what we call a care farming project. And essentially, it's Sally Bungalonta coordinating with Dr. Tancho Chong and his staff at the Mga Gawa. I believe Jonah is here. Because we realize that one of the major problems now is joblessness and possibly food insecurity. We're looking at farming in idle lands or even in the urban sectors of the community to the extent that it is allowed to be able to grow vegetables using seeds from the DENR. We have gotten some free seeds from the DENR. And right now, Sally Bungalonta is actually doing this with a group in Antipolo while Jonah is doing this in, I believe, Tala, no? Novaliches. Jonah, are you there? Or Dr. Tan will probably can give us some details. But at least there are two areas where this is happening now. Some of you might be interested, initiate or launch something similar because one of our major issues now is really getting the economy humming again and helping people. The part of the mental health recovery will be economic recovery. And so I think we're looking at this as one approach to promoting well-being. Those are the three main things.
I hope a clown comes in.
Thank you, Dr. Lucy Lasso. Any other announcement, Dr. Tancho Chong?
Jonah, you want to say something, Jonah? I think Jonah is there. Jonah, would you like to say something?
Yes, Doc. Hello, good afternoon to everyone.
Yes.
Opo. Yes, as what Ma'am Lucy said, we are doing home gardening in Caloocan, San Jose del Monte, Bulacan, and Norzagaray. Actually, we have a call at Cavite, pero we have medyo may issue pa tayo sa transportation. One thing, sa ngayon, si Doc kasi nagpadala siya ng rice. So, ang gagawin namin sa rice, gagawin namin siyang award system. So, the women in the community will have, parang may ano po sila, contest sila for home gardening. And we will visit them by the end of September para mak-check namin yung kanilang gardens. And of course, kung sino yung pinakamaganda yung garden, we will give rewards through the rice from Dr. Tan and the kaisa para sa kaunlaran. Yun po. So, for now, another activities po, yung mga kids na nagbebenta sila ng kalakal, kinukuha natin yung kalakal nila, pinapalitan namin ng rice para we can use yung mga pet bottles para sa rooftop gardening or sa vertical kind of farming. Yun, Doc.
Thank you, John.
Doc, thank you, Jonah. Doc, do you have any words to say?
Nothing more.
Wala. Nothing. So this is the last presentation for Joint Forum.
Yeah. But
okay.
But maybe
may we request
possible maybe in the future we can always have join hands together to have other webinar and other projects. Okay.
Okay.
Go to the closing.
Okay. For the closing, may we request Dr. Lucy Lasso for the closing remarks?
I can see it's already 4:06. We're going past our time, no? So, first of all, I'd like to thank our resource persons, Dr. Randy Dellosa and Dr. Mike Vergara, no?
Vergara.
Vergara, no?
So for sparing their time today, I am sure there's more. If we had more time, we can explore these topics further, both from a practical or applied point of view, as well as from a more scientific point of view, no, so that we get to explore the value and the utility of these approaches. For now, however, as you mentioned, this is the third in the three webinar series that we have. Again, I said earlier, this was organized around the theme of self-care in mental health. What we wanted to do was basically to share and encourage people to engage in mental health care and to explain why it is necessary, what it is all about, and how can one do it in practical terms. So we had these three webinars, but obviously there's more to be said, more can be said, and more sharing can be done because each one of us, each one of the participants may have more to say. But I hope this will not end here. I would also, the intersection here is Dr. Tancho Chong, no? Because he's the common element between Philippine Academy of Acupuncture and the WAPR. And we thought that the PAAI and WAPR can join hands in helping people cope, if you like, with the anxieties and stresses that this pandemic brings. We haven't seen the end of it. I'm not sure that the end of the tunnel is really there yet. When Dr. Vergara spoke, he actually put it into context and he said, there's still different versions, there's still different reports. So we leave it at that. But we will have, I think the key message for all of us is we all have to take care of our own mental health. We have to take charge. That's what we're saying. By knowing what can be done and why you have to do it, we thought we can get everyone to be part of that movement, if you like, of self-care in mental health. So thank you also very much for joining us, and perhaps subject to availability of people, we may have some webinars in the future. Thank you, Letty, for moderating. Thank you to the PAAI, Jackson, for being the IT anchor, and everybody else in the PAAI for collaborating with us.
Thank you, WAPR. And may we request everyone to have their big smile for the last group picture. Can we see you at your...
I see Dr. Imelda Martin, ano? Hi, Dr. Imelda Martin from WAPR. Okay.
Okay. Can we have a group picture? Sir Jackson?
Kailangan.
Can you open your windows? Merry Christmas, everyone.
Merry Christmas.
An early greeting from...
Thank you very much.
Thank you.
An early greeting from PAA.
For joining us.
Okay.
Thank you for joining us. Yes.
Tapos na ba, Letty?
Opo.
Salamat.
Okay.
Thank you po. Thank you po.
Salamat, Jackson. We meet you again.
Thank you po.
Thank you, ma'am.
Thank you po.
Thank you.
Bye.
Okay.